I had lower eye bag surgery 9 days ago. In the last couple of days, I have noticed a gel-like bubble on the white of my eye. I saw a doctor today who said it was a blister on my eye, and this could be the result of post-op swelling or a dissolvable stitch inside my eye could be irritating it. He didn't want to provide me with steroid drops, as he said this would slow down the healing. I am placing cold compress on my eye as much as possible, and using my drops every 2 hours. It's getting me down. How long will this continue? Please tell me it will eventually go. Is it normal to feel pain?
Thank you for your question. You've submitted a photo showing the right eye, and you are stating in your question that you had surgery 9 days ago, and that you noticed the formation of a blister on the white part of your eye. And when you brought this to the attention to your doctor stated that it may be related to a suture, dissolving stitch, and also that the doctor didn't want to give you steroid drops because of concerns of slowing down healing process. And so you're at a place where you're doing cold compresses, you're putting eye drops in, and you want to know if this will go away and is it normal for there to be pain. Well, I can help you with this question. Certainly, I'm a board-certified cosmetic surgeon, and I'm a fellowship-trained oculofacial plastic and reconstructive surgeon. In addition, just for clarification, I did a residency first in ophthalmology and eye surgery before specialized training in plastic surgery of the eyes. And I've been in practice for over 20 years in Manhattan and Long Island. So let's start by just defining what is this area of this elevation. Now, when you have surgery on your eyelids, let's just go back a little bit. When you have surgery of your eyelids, you notice that you have some bruising under your eyes, some black and blue. Well, if you had a procedure like a transconjunctival procedure, like a transconjunctival blepharoplasty, which means that the surgery is done from the inside of the eyelid through the conjunctiva, then it is possible for fluid to track along under the conjunctiva over the eyeball. And so it is possible that you could have had just tracking of fluid that then collected in one area. So we often refer to that as chemosis. We also can say that maybe there was a localized irritation that caused some reactive swelling and fluid collection in that area. Regardless, as long as there's no obvious signs of infection or inflammation, then it certainly makes sense not to use an antibiotic or a steroid drop, but rather to allow the fluid to get absorbed. I always explain to our patients that the fluid swelling on the conjunctiva is similar to the swelling that is under the skin, in that but what's different is the conjunctiva is clear while the skin is not. That being said, it will take some time. It'll take a couple of weeks typically for this to fully get absorbed, and it often looks much worse than it actually feels. It's basically, regardless of the etiology, it's fluid. As long as there is no other ophthalmic compromise where there is problems with vision or with the possibility of infection, and it sounds like you and your doctor have a good dialogue and you're getting the information and feedback and guidance. So I think that most likely, just based on these photos alone and your description and without the benefit of a physical examination, I think you can anticipate that things will get better. In the meantime, I think it's important that you maintain constant communication with your doctor, and I'm sure you've got some office visits already scheduled to follow your progress along the way. So I hope that was helpful. I wish you the best of luck, and thank you for your question.